sinus and scalp-based surgery. It's part of the integrated specialized cadaveric dissection program from our ENT department. In this workshop, we are collaborating with the neurosurgical colleagues from also from Ain Shams, Tariq Lutfi and Asim Munir will be joining us later. This is our faculty. Unfortunately, Professor Hilal is, for family reasons, he's out of country, so we are missing him this course. Professor Tarabishi, one of our teachers that we owe them a lot, he and Dr. Hilal, for the advances in the endoscopic sinus surgery. He will be joining us. Me and Dr. Amr Gouda will be joining us, and of course Dr. Sharnobi. He's not ليس هو الجندي المجهول، لكن هو الظاهر والواضح ومجهول معاكم من الكورس اللي فات البيزك and so on. He's now a keystone in our team. Professor Tamer Youssef and Dr. Ahmed Nabil joining us, and Professor Tariq Salim and Dr. Asim Munir will be joining us. Objectives of our course in the advanced part, so to enhance the knowledge of the surgical endoscopic anatomy, which is very much needs training and continuous dissection, so that you master this anatomy knowledge in a 3D concept using the endoscopes. Enhancing the skill in the endonasal procedures, you can advance at whatever level of expertise that you will develop in your practice. It's you that you will know what you want to do and how you want to expand your work, either in single modality treatment, single specialty, or in a multi-speciality with your neurosurgical colleagues. So according to your setting and your preference, this is a clinical practice that you should develop. But always reminding of the oath of Hippocrates that we all practice underneath, and the most important thing, always do no harm to the patient. So to do that, so you need to practice and to develop your experience. In our course, we are focusing in the anterior and middle cranial base dissection from the endonasal corridor and the advances through the orbit and the pterygium and the maxilla to the infratemporal fossa and so on. This is the concept, that the area that you can join or you can approach endoscopically. Aim of our workshop this time is to know the anatomy and to know how the limit, of course, how can you advance in these areas safely based on anatomical landmarks. Always we depend on pony anatomies. Because of you have a tumor, a pathology, it will disturb soft tissue, so that you always look for a fixed pony anatomy that you need to focus. If you have a navigation system, that will add you, but also this navigation depends on poles, so you have to have poles and you rely upon. In 1994, May and Ital, they introduced 6 friendly anatomical landmarks. Dr. Ahmed Nabil will display to us the anatomy, but always remember that we have 6 areas that always, even in recurrent cases and so on, we have a fixed areas that you can go back to it to rely upon. Okay, the lacrimal, the posterior edge of the lacrimal pole, the anterosuperior attachment of the middle turbinate, the middle meatal antrostomy, and the quara, the nasal septum, the medial orbital wall, or the lamina papyrus. Always look for an anatomical landmark so that you know the other areas that you need to focus, to search for. Always remember, you have what you read, know, you can see, and observe, train to achieve a safe practice. This is the our just modified course, just filling. This is our last program. Dr. Ahmed Nabil now will display to us the endoscopic anatomy, and then we will continue on the dissection part. Dr. Ahmed Nabil.